Welcome to this deep dive into the future of healthcare. You've given us so much to work with, articles and research all pointing to some incredible breakthroughs that are happening right now. It's exciting to see how much of it is focused on personalized healthcare, like treatments tailored to your genes and AI analyzing your health data to give you unique insights. And we've got our expert here to help break it all down and offer those aha moments. So let's dive right in. One of the first things that jumped out at me was AI's role in diagnostics. One article even mentioned AI outperforming doctors in certain areas like analyzing medical images. Apparently, it's using this thing called deep learning to do it, where it learns from huge data sets of images to spot patterns that humans might miss.
Yeah, it's really fascinating. These algorithms can find even the smallest abnormalities in images, like X-rays, MRIs, even retinal scans. And in many cases, they're actually more accurate than experienced radiologists. Think about what that means for something like early cancer detection, where catching it early can make all the difference. AI could flag those tiny tumors that might have otherwise been missed.
That makes sense. But it also raises a question for me. If this AI is learning from past data, what if there were biases in that data? Like, historically, certain demographics might not have had equal access to healthcare, so their scans might be underrepresented in the data. Could that skew the AI's analysis?
Absolutely, that's a crucial point. The developers are working hard to make sure the data used to train these AI models is diverse and representative. They're using techniques like data augmentation and synthetic data generation to fill in potential gaps and make this system as accurate as possible.
Okay, that's good to hear. But it's not just about spotting problems, right? I saw some articles about AI being used to create personalized treatment plans, especially in complex areas like cancer treatment.
Right. In oncology, one of the biggest challenges is finding the best treatment path for each patient. You have to consider things like tumor type, their genetic makeup, and what treatments they've had before. AI is really changing the game for oncologists. It can analyze huge amounts of data to figure out the most effective treatments for similar cases.
So it's like having a super smart consultant working alongside the doctor.
Exactly. It can sift through all that information and offer insights in a fraction of the time it would take a human.
Wow, so it's not about replacing doctors, but giving them a powerful tool to make even better decisions.
Precisely.
That's a relief. It makes me feel a lot better to know that AI is becoming more of a partner in healthcare and not a replacement.
Mm.
But I have to admit, the thought of machines making life or death decisions still makes me a bit uneasy. What about the human touch? The empathy and intuition that doctors bring to the table?
I understand that concern. And you're right, that human element is so important and can't be replaced. At the end of the day, AI is a tool. It's up to healthcare professionals to use it wisely, combining your own judgment with the insights AI provides.
That makes sense.
The goal is to have a collaborative approach where human expertise and technology work together to provide the best possible care.
Okay, so we've got AI analyzing images, recommending treatments, but what about the individual themselves? That's where personalized medicine comes in, right? Using our own genetic information to tailor our healthcare. I keep seeing this term pharmacogenomics pop up everywhere. What exactly is that?
Well, pharmacogenomics is basically the study of how your genes affect your response to medications. Everyone's genetic makeup is different, and those variations can change how your body processes drugs. It might mean some medications are more effective for you than for others, or you might have more side effects from certain drugs.
That could be huge for people who've had trouble finding the right medication, especially with conditions like depression or chronic pain, where it can take forever to find something that works.
Definitely. With pharmacogenomics, doctors can make smarter prescribing decisions. They can choose the medication and dosage that's most likely to work for you based on your genes.
So it could cut down on the trial and error and help people get the right treatment faster. This is incredible. It's like we're finally figuring out why certain medications work for some people but not others. And it's not just about existing drugs, right? I read that pharmacogenomics is also being used to develop brand new medications.
You're right. By understanding the genetic roots of diseases, researchers can develop drugs that target those specific pathways.
So we're talking about treatments that are literally tailored to your individual DNA.
Exactly.
This is blowing my mind, but I have to wonder how accessible all this is. Is this just for people who can afford expensive genetic testing?
That's a great question, and it's a really important one. The good news is the cost of genetic sequencing has been dropping dramatically.
Yeah.
So it's becoming more accessible to more people. And we're also seeing the development of at-home genetic testing kits. That can tell you about your health risks, your ancestry, and even how you might respond to certain medications.
That's amazing. It means these advancements aren't just for the wealthy few.
Exactly. The goal is to make personalized medicine available to everyone, to empower people to take control of their health and make informed decisions.
This is definitely a future I want to be a part of. But I do have one concern. I can't help but think about data privacy. If all this personal health information is being collected, including our genetic data, how do we know it's being protected? How do we prevent it from being misused?
That's a valid concern. And it's something that researchers, healthcare providers, and policymakers are taking very seriously. There are strict data privacy regulations being developed to make sure individuals have control over their genetic information and how it can be used.
So it sounds like the future of healthcare isn't just about technological advancements, it's about using those advancements responsibly and ethically. But we've only just scratched the surface. What about telemedicine and mental health? There's so much happening in those areas too.
You're absolutely right. Telemedicine and mental health are both undergoing incredible transformations. With new technologies changing how we access and experience care, we'll dive into all that in the next part of our deep dive.
So, telemedicine, it feels like it's gone way beyond those basic video calls with your doctor.
It really has. We're seeing this amazing blend of AI, remote monitoring devices, and those mobile health apps. It's all coming together for a connected healthcare experience.
Yeah, I'm seeing that too. It feels like it's becoming more comprehensive, proactive even, like moving away from just reacting to being sick.
That's it. It's about continuous monitoring and catching things early. Like imagine someone with a chronic condition, let's say heart failure.
Okay, yeah.
Instead of waiting for things to get worse, they could have a wearable that's always checking their heart rhythm, fluid levels, even how active they are.
Right.
And all that data goes straight to their doctor.
Wow.
If the AI sees anything off, it can alert the doctor who can adjust medications or suggest lifestyle changes before it becomes an emergency.
That's incredible. It feels like it really puts people in charge of their own health. But what about people who aren't so tech savvy, especially older adults? Are they being left behind?
That's a really important point. But the good news is those user interfaces, they're getting so much easier to use. And there's a big push to design telemedicine solutions specifically for older folks.
Makes sense.
Think voice-activated assistants, helping schedule appointments, medication reminders that are super simple to set up, even those monitoring devices that are really user-friendly, don't require a lot of fiddling.
So it's about making the tech work for people no matter their age or tech skills. I like that. And telemedicine has been huge for mental health too, especially all the teletherapy I've been hearing about.
Definitely. It's become essential for so many people. It's convenient, accessible mental health care. And studies are showing it's just as effective as in-person therapy for a whole bunch of conditions, from anxiety and depression to PTSD and trauma.
Yeah, I can see that, especially for people in rural areas or anyone who has trouble getting to traditional therapy.
Exactly. It breaks down those barriers so location or mobility issues aren't a problem. And for people who might feel, I don't know, awkward or ashamed about seeking help in person, that anonymity of teletherapy can be a big relief.
It's removing those obstacles that might keep someone from getting help. But what about the other side of that, the digital divide? Not everyone has good internet or can afford the devices they need for telemedicine, right?
That's true, and that's something we need to work on. But there are programs trying to fix that, like expanding broadband access and providing devices to communities that need them.
Oh, good.
Some health systems are even teaming up with community groups to offer free or low-cost internet and tablets to patients so everyone can benefit.
That's great. It seems like there's a real effort to make telemedicine work for everyone. And it's not just therapy, right? I've seen articles about all these other digital mental health tools, like AI chatbots and even virtual reality therapy. What?
Yeah. It's a really exciting field. Those chatbots can provide support anytime, offering coping strategies, guided meditation, or just being there to listen when someone's struggling.
It's like having a therapist in your pocket. But what about virtual reality therapy? How does that even work?
It's amazing. They create these immersive, interactive worlds so the therapist can guide patients through simulations designed for their needs.
Oh, wow.
Imagine someone with a fear of flying using VR to experience a flight, in a safe environment, to get over that anxiety. Or a veteran with PTSD revisiting a traumatic memory in a controlled way to process it.
That's powerful. It's like taking the power of imagination and making it therapeutic. But it's
Yeah,
not just technology, is it? It feels like the whole conversation around mental health is changing.
it really is. There's less stigma around mental health these days. People are understanding that it's just as important as physical health. And we're seeing more mental health programs in schools, workplaces, communities. It's creating a more supportive environment overall.
That's really encouraging. But even with all this good stuff, what about the risks of relying too much on technology? Could we lose that human connection that's so important in mental health care?
That's a valid concern. Technology should never replace human interaction. It's about finding the right balance,
Hmm.
using it to support and improve existing models of care, not replace therapists or support networks.
Yeah.
It's about using technology to connect people, make care easier to access, and help people take charge of their mental well-being.
I like that. It's not about choosing one or the other, tech or human connection. It's about bringing them together in a smart way.
Exactly. The future of mental health care is about that collaboration, where technology and human expertise work together to create a better system for everyone.
Okay, so we've covered AI, personalized medicine, telemedicine, and all these amazing developments in mental health. Phew, my brain is full. So where do we even start to make sense of all this?
It is a lot to take in, that's for sure. But the most important thing to remember is we're witnessing a revolution in healthcare, and it has the potential to make all our lives better.
Okay, yeah.
It's up to each of us to stay informed, talk about it, and advocate for a future where healthcare is fair, accessible, and helps everyone live healthier and happier lives.
Well said. I'm excited to see where all this goes, and I'm glad you're here to guide us through it. But let's bring it back to our listener. What does all this mean for them? How can they understand these advancements and what they might mean for their own health?
That's what we'll explore in the final part of our deep dive.
Okay, so we've covered a ton in this deep dive. AI changing how we diagnose, personalized medicine tailoring treatments to your genes, telemedicine opening up access, and all those incredible innovations in mental health. It's a lot.
It is, yeah. Feels like a whole new era of healthcare is emerging.
Totally. And I keep thinking about everyone listening, trying to wrap their heads around it all. Like, what does it actually mean for you, for your health, for the choices you'll make in the future?
Well, for me, I think the most exciting part is the potential for people to have more control over their own health. More personalized information, more options. You're not just along for the ride anymore.
Yeah, it's like going from a passive patient to like a health advocate.
Exactly. Imagine knowing your whole genetic profile, understanding your risks, and then working with your doctor to create a plan to stay healthy. Or if
Mhm.
you do get sick, having treatments that are designed just for you, so they work better and have fewer side effects.
It's a pretty powerful vision, but I can also see how it could feel kind of overwhelming. So much info, so many choices. How do you even know what's right for you?
That's where having a good doctor is so important. Even with all this tech and data, you still need someone you trust to help you make sense of it all, someone to guide you and help you make the best decisions for you.
So it's not about technology replacing human connection in healthcare.
No, not at all.
It's more like it's enhancing it.
Right. It's a partnership. Your doctor becomes more like a coach, working with you to navigate this new world of healthcare.
I like that. That makes me think about access, though. As amazing as all this is, will everyone be able to benefit from it? Or will it just be for people who can afford it?
That's a huge question. We have to make sure these advancements don't make healthcare inequalities worse. Everyone should have access to these technologies and treatments, no matter their income or where they live.
Totally agree. But let's focus on the positive for a minute. If you had to pick one advancement you're most excited about, what would it be?
Hmm, that's a tough one. But I think I'd have to go with the shift from reacting to illness to preventing it altogether. Imagine a world where we can see health risks early on and then step in and stop them before they become problems. That's the power of personalized medicine and AI working together.
I love that. That's a future we can all get behind. But as we wrap up this deep dive, I want to leave everyone with a question to think about. With all these amazing things happening in healthcare, what are you most excited about? And what worries you?
Yeah, what role do you want technology to play in your own health? And how can you help shape a future of healthcare that benefits everyone?
Great questions. The future of healthcare is being shaped right now, and we all have a role to play. Thanks for joining us for this deep dive. It's been a fascinating journey.
It really has. Thanks for having me.